Hello. Hi. My name is Susan. I'm going to be your nurse today. Let me shut this curtain. All right. Like I said, I'm going to be your nurse today. And it looks like you're here with your daughter. So I'm going to be doing a head-to-toe assessment. If you want her to stay, she's more than welcome to. If you want her to leave, then that's fine too. It's up to you. Okay. All right, she can stay. All right, let me get on some gloves really quick. All right, so like I said, my name is Susan, and I'm going to be doing a head-to-toe assessment. But before I do that, I need to verify your name and date of birth. All right, what's your name? All right, Steve Silva. All right, and your date of birth is December 30th, 1991. All right. Okay. So if you don't mind, I'm gonna just update this whiteboard really quick. Okay, perfect. And it doesn't look like you're in a lot of distress right now. No, you're doing okay? All right, good. I am glad to hear that. So, like I said before, I'm going to do a head-to-toe assessment. I just need to do this for documentation purposes for my shift, and then making sure that throughout the day, if things change from what your baseline is right now, that I know and I can make sure that that's all recorded for you and for us too, okay? All right. So, just so you know, I'm going to be writing down different things that I find on my documentation right here. If you have any questions throughout this process at all, don't hesitate to stop me and ask. I am more than willing to answer your questions for you, okay? All right. So let me just raise the head of the bed, raise the bed really quick. Is the head of the bed okay? Are you comfortable in this position? All right. Okay, so that head of the bed is raised. I'm going to be checking your vital signs, so let's first get a temperature. Okay. All right, that's 99.1. All right, and then I'm going to do pulse ox on this side, and then I'm going to go ahead and get the blood pressure cuff on the other side, okay? Blood pressure cuff. All right, your pulse ox saying 99. Let's take that off. All right. So let me go ahead and clean this stethoscope. All right, I'm gonna take your blood pressure, listen to your heart, and then we'll be moving on, okay? All right. Okay, perfect. So your blood pressure is 132/78. You write that down, and I'm going to take a listen to your heart real quick, okay? So I'm going to go ahead and put this bell, the stethoscope, on your chest. So I'm going to come right over here. All right, I'm listening to that. Oh, it's called the apical pulse. And time it for a minute, okay? Your heart's really strong. It's doing really good. All right, Mr. Silva. All right, listen to that for a full minute. So your heart rate is at 78. That's great. And then your respirations are at 15. So everything's looking pretty good. Now, Mr. Silva, are you in any pain today? Your back. Okay, all right. And can you, which is why you're here, you fell, right? You hit your back on, or you fell onto your back from pretty high fall. Yeah. So I know that that's probably pretty painful. Can you tell me where on your back it's hurting? The lower back? Okay. All right. And also, on a scale of 0 to 10, can you rate that pain for me? All right. Right now it's at a 4. Okay. All right. And then can you tell me about your pain? Is it constant? Or does it come and go? It's constant, all right. And can you describe it? Like, is it sharp, stabbing, dull, achy, stinging? It's like a dull, achy pain. Okay. Now, does that pain radiate, like go to different areas of your body at all? No? Okay. All right. And what makes it better? the medication we've been giving you. All right. Do you know what that medication's called? Exactly. It's tramadol. Good job. Do you know when it was last given to you? All right. Good. Okay. That's what I have in the chart too. So that's good. Do you feel like that pain medication is working for you? It does. Oh, so if your pain's at like a 6, then it goes down to like a 2, is what you're saying? Excellent. That's really good. That is really good. And you're happy with the pain management. Okay. All right. Also, here, let me write this down really quick. So also, what makes the pain worse? Sorry. Twisting and moving your back. Okay. All right. Does walking make it worse at all? Not so bad if the pain's under control. Okay. All right. Good. And have you tried any like non-medication ways to help the pain? They were doing some heat. Is that what you said? That's what you did at home. Okay. All right. So, and was that working? Took it away for a little bit, but not so much. Okay. There might be some other things that we could try later if you're interested. If not, we're going to continue the tramadol anyways. But it's always good to have non-pharmacological methods of pain control as well. So if you're interested, just let me know and I could go over some of those with you. All right. Okay, so before I move on, what I'm going to do is I'm going to get a new set of gloves on really quick. Okay, a new set of gloves. All right, so I'm going to take a look at your IV site. Okay, so I'm going to just start with this, make sure this is all working properly. Okay, so let me just take your arm. All right, I am not seeing any redness. It doesn't look like it's tender. Is it tender at all? No? Okay. There's no swelling, and the dressing is secured and intact. Okay. I'm going to get this saline flush, and I'm going to unlock this and just flush it really quick, okay? All right, the patency is good. I was able to get that through. And then let me just come over here. All right, so this is saying normal saline, infusing at a rate of 100. It's for you. 100 mLs an hour. 100 mLs an hour. Great. It's infusing at the correct rate, so that's good. Let me just document that really quick. All right. So, because you're taking tramadol, I just want to, and you're on fluids, there's different assessments I'm going to be doing, so like a respiratory assessment, making sure, respiratory and cardiovascular, just making sure that you're not having fluid overload. I also will do like a cognitive assessment, just so that we can make sure that you are safe, and that the effects of medication are not adverse effects that could be harmful. Okay, so far I think that it's been working pretty well. You haven't reported any side effects that are too bad. All right, okay. So the first thing I'm going to go into is a neurological assessment. So can you tell me where you're at? Okay, do you know why you're here? All right, and what year is it? Okay. And you already told me your name and date of birth, so we're good there. Let me just write this down. Okay. Now, Mr. Silva. Oh, I can call you Steve. Okay. So, Steve, do you wear any glasses or contacts? No. Okay. What about hearing aids or dentures? No. Okay. Do you have trouble with hearing? No? Okay. Any trouble with your vision? All right. So I'm going to go ahead and take my pen line. I'm going to just look at your eyes, make sure they're working appropriately, okay? So just stare off into space, and then I'm going to take this. All right. They're both reacting good. Reacting good. All right. Now look at this pen light. And I'm going to bring it towards your nose and just follow it for me. Excellent. Good job. All right. Now I'm going to just look in your mouth. All right. No dryness or anything like that. Okay, good. All right. Let's just write these down. All right, the next thing I need you to do is, can you just shrug your shoulders and smile for me? All right, just like that. Excellent. All right, so now go ahead and hold out your arms, both arms straight in front of you, and hold them for 10 seconds. Try not to let them fall down. If they fall, it's fine. All right, good. And now what I want you to do is grab my fingers. Okay, now push up with your hands, push down with your hands. All right, and wiggle your fingers for me. Good. Now, do you have any numbness, tingling in your fingers at all? None. Oh, that's excellent. Okay. When I was touching your hand, could you feel me touch it? All right. All right. Excellent. All right. Now, what I'm going to do is we're going to move to your legs, okay? So I'm going to pull this down and the blanket. Oh, you're warm anyways. Okay, good. So let's just pull this down. Now, I'm going to kind of do the same thing that we did with your arms with your feet, or your legs. So go ahead and lift your right leg for 5 seconds and hold it in the air. Good job. Okay, and do your left leg. Okay, good job. Now, pull your toes towards your head. Okay, good. And push down. All right. And can you feel me touching you? You can? Okay, good. And then can you wiggle your toes for me? All right. Any burning, stinging sensations in your feet at all? None. Okay, excellent. No tingling in your feet either? All right. Okay, so Steve, we're going to be moving on to me listening to your heart, lungs, and stomach, okay, your abdomen a little bit, and then I will turn you over onto your back and take a look at your back, and we'll do it gently, okay, because I know you're in a little bit of pain. We'll try and do that. What we will do is move you onto your side so I can take a look at your back here at the end so that we don't have to do it right away. Okay. All right. So the first thing I'm going to do, I'm just going to listen to your lungs. I'm going to listen on the front, I'm going to listen on the back, and I'm going to listen on the sides, okay? And every time I move the stethoscope, I want you to take a deep breath for me, okay? So let me clean this really quick again. Okay. All right. Okie dokie. So go ahead, sit up tall. Take a deep breath. All right. That one's clear to auscultation on the right hand side. Clear to auscultation on the upper left. Clear to auscultation on the lower left. And clear to auscultation on the lower right. Good job doing those deep breaths. Now I'm going to come up on the sides, okay? Deep breath. Clear to auscultation on the right, the right side. And we'll come up over here. Deep breath. Clear to auscultation on the left side. All right, Steve, I'm going to have you sit up, lean forward a little bit so I can do your back, okay? All right, go ahead, sit up. Okay, take a deep breath. Excellent, clear. Clear to auscultation there. Clear to auscultation on the left there. Clear to auscultation on the right. And last two, okay, Steve? Both of those are clear to auscultation. Good. So I'm just checking there to make sure you don't have like any fluid. I can hear maybe fluid in your lungs, but I don't, so that's good, okay? All right. Was that uncomfortable for you to sit forward at all? No? Okay, good. All right. Do you have any shortness of breath at all? No? No shortness of breath? Okay, good. That's great. Now, could you cough for me and we could try and get up some of the secretions that might be trapped in there? Just a deep, hard cough. Excellent. Good. I didn't hear any secretions. That's great. Let me go ahead and write that down. You're not using a chest tube or oxygen mask, so you're not on any oxygen, so we're good there. All right. Okay, so the next thing that I'm going to do is I'm just going to listen to your heart. There's a couple different places I'm going to listen to. I'm going to listen for irregularity. I already took your ab pulse, but I'm going to listen to make sure your heart is strong again, okay? All right. Okay, so go ahead and tilt your head forward for me so I can get to your chest. Okay. So the first place I'm looking or I'm listening is the second right intercostal space for the aortic valve. Okay, the second is the second left intercostal space for the pulmonic valve. Then the fifth intercostal space, left sternal border, and that's for the tricuspid valve. And then the fifth intercostal space, left mid-clavicular line, is for the mitral. All right. I already listened to the apical pulse for a full minute when I was taking vital signs, and it was regular, rate and rhythm, no irregularities. You're not on telemetry. Your heart's still sounding really, really good. All right. Have you ever had any problems with your heart? No. Good. I didn't hear any murmurs or anything like that either. All right. So let me just document this really quick. Okay. All right. I'm just going to feel your pulses on your extremities and test capillary refill in your fingers. So I'm going to be pinching your nails on both your hands and feet. Okay. All right. I'm not seeing any edema in the hands. Both upper extremity peripheral pulses are present and normal. Okay. Hands are not cold. Capillary refill. Excellent. All right, legs. I don't see any edema. All right, let me just assess your pulses. These pedal pulses. All right, they're equal with each other. They're normal rate. They're not bounding. They're not thready or weak. They're pretty normal. Capillary refill. Okay, good job, Steve. All right, let me document that. Okay. All right, so moving on. Do you have any nausea, vomiting, or diarrhea? You're a bit nauseous? Okay, but no diarrhea, no vomiting. No, okay, all right. Any indigestion, heartburn? No, okay. Have you been able to eat at all? You haven't had an appetite, okay. No appetite, okay. And have you tried eating anything? Not that much. The only thing that you feel like you could eat would be like Jell-O. Okay, all right. We can get some of that in here, but it's important for us to get some good quality nutrients too, okay? All right. When was the last time you had a bowel movement? This morning? Okay. All right. All right. And what are you able to pass gas just fine? Okay. All right. Great. So what I'm going to do now is I'm going to listen to your stomach. I'm going to listen in 4 different spots, checking for just your bowel sounds. Okay. So I'm going to go ahead and lower the bed a little. Well, not lower the bed, but like lower the head of the bed. And I'm going to go ahead and listen to your bowel sounds, okay? Let's pull this down. All right. Upper right quadrant, normal active. Upper left, normal active. Lower left, normal active. Lower right, normal active. I'm not seeing any Distension. There's slight distension in the bladder area. Is it painful? When was the last time you went pee? You haven't gone since you've been here? Okay, all right. So before I move on, I'm gonna palpate your stomach. You tell me if there's any pain, okay? No pain? Okay. None there. None there. And none there? Okay, good. All right. So it does look like your bladder's a little distended. You said you haven't been able to void since you've been here. Let's raise the head of the bed again. All right. So where did my pen go? Normal active bowel sounds. No firmness. No pain. No distension in the stomach. So do you feel like you need to pee? You feel like your bladder's full, but you just can't. Okay. All right. Okay. You're not incontinent. You can go to the bathroom by yourself. All right. Do you mind if I check your perineal area? You do not want me to do that now. Okay, I understand. All right. So, what I think it would be good to do is to check and see with like a bladder scanner to see if you have if you do actually have some urine. It looks a little distended. It might not be, but we'll see. Okay, and then if need be, if you can't void, we might have to do a catheter. It's a straight catheter. It's not one that stays in you. It's quick. And we can, if there is urine in there, we can get it out, okay? Because if we leave it in there, then it could cause an infection, okay? And that's something we do not want. All right. All right, let me go here. Okay. So, again, the last areas that I need to check are your back. I'm going to look at pressure point areas, make sure that we're not seeing any signs of pressure ulcers, and then we should be done, okay? All right, so I'm going to just look. There's nothing on the bottom of the heels. All right, elbows. Okay. Nothing there. Okay. All right, so let's go ahead and lower the head of the bed, and I'll have you roll towards me, and I'll check your back, okay? All right, lowering the head of the bed. All right, if you're able to, Steve, go ahead and cross your left leg over your right. I can help you. All right, are you in any pain? No? Okay, so I'm going to put my hand on your hip and my hand on your shoulder, and you go ahead and pull yourself towards me too, okay? All right, we went slow. Are you doing okay? All right, good. I'm going to be quick, okay? So I'm not seeing anything here. There's nothing on this side. He has no signs of pressure ulcers there. It's not incontinent. There's slight bruising on the lower back, maybe where he fell. I'm not going to palpate it. Maybe a little bit of swelling over here too. Okay. All right, we're going to roll you back down, okay? Slow and steady. All right, you want the head of the bed elevated again? All right. Okay, let me just note some of those things. All right. You were hot, so you weren't wearing socks, so I could easily check your feet. That's good. All right. Bruising, swelling. And it's tender on your back. All right. Okay. All right, Mr. Silva, Steve. Do you have any questions for me before I go? No. Okay. All right. If you do have any questions at all, don't hesitate to ask me. Push the call button. It's right here. And we can get those questions answered. All right. I have a question for you. Do you have any goals for the day? Okay. If you don't have any goals, do you mind if I propose a goal? Okay. my goal for you would be to get up and maybe walk a little bit today. Walking will help prevent any clots in your legs, which can lead to more complications. So if we can get you up walking maybe 2 times a day, and then potentially use some non-pharmacological methods of pain management, I think those are 2 really good goals to help you get you walking to prevent any further injury, as well as pain management. So all right. I don't think that you, I know you don't have any other pertinent medical history. I think the plan for the day is to just, make sure you're comfortable, make sure that we can get you healed, make sure your bladder or your kidneys and your bladder are working properly. Hopefully getting some test results back to see how everything's going. And then, moving on with the day, getting you walking, talking, socializing, and hopefully eating too, okay? All right. Let me just return this bed down. All right, your call light's right here next to you if you need anything. I'm going to go document these findings that I've written down here into your chart, and then I will be back shortly with your next dose of pain meds. Okay, probably in the next 30 minutes or so I'll be back. 30 minutes to an hour, I think. I think it's actually due. Yeah, it's due in about an hour. All right, so I'll be back in about an hour, okay? Before I leave, let me clean my stethoscope. Do you have any questions? None? Okay. And then I already cleaned my pen light, so I'll toss that. All right. Hand sanitizer. Okay, Mr. Silva, I will see you in about an hour, okay? All right, bye-bye.